Awesome. Okay, so I wanted to introduce to you all, if you're not familiar, Groundwork Lawrence. So Groundwork Lawrence is a nonprofit environmental organization that has been in Lawrence since 1999. And this year we proudly celebrate 25 years of changing places, changing lives, and changing systems. So our mission is to bring about the sustained regeneration, improvement, and management of the physical environment by developing community-based partnerships, which empower people, businesses, and organizations to promote environmental, economic, and social well-being. And our vision is an equitable community where the residents of Greater Lawrence in all stages of life feel they belong, are safe, supported, and empowered, where healthy living is the norm and everyone's neighborhood is a resilient environment that thrives with parks, trees, and open spaces. Climate Safe Neighborhoods Project. So it's a national partnership led by Groundwork USA. The Climate Safe Neighborhoods, or CSN project, focuses on combating extreme heat and flooding by addressing the impact of historical race-based housing segregation on current and predicted impacts of climate change. So there are different cities around different states around the United States who are participating in this project and who are making change in their neighborhoods. There are 2 QR codes here on this slide, and I'll also be sharing the links to all of these. So on this side, we have a QR code that will lead you to our Climate Safe Neighborhoods Groundwork Lawrence page. And then the QR code on the right here, will bring you towards the Lawrence CSN story map. Here we have some pictures of the Lower Tower Hill neighborhood, which can be found in our dashboard. So in this image here, we have the median surface temperature. Do you notice anything in particular? Anything that you notice here that you'd want to mention in the chat? Over here, we have a picture that highlights the amount of impervious surfaces. And right there on the bottom, oops, my bad. This image right here highlights the percentage of tree canopy. So if you can kind of see, there's this faint outline of the neighborhood which we're focusing on for the Climate Safe Neighborhoods project. One thing that stands out for sure is this particular area that's pretty red. So if you were or are familiar with the neighborhood in that particular section, there are a high percentage of impervious surfaces and also a lot of auto shops as well. Lawrence Palante, you may have heard of us. You may have seen the group page on Instagram. It is made up of a group of Lawrence residents working to promote different measures for addressing the problem of extreme heat and flooding in Lawrence, especially in the Lower Tower neighborhood. So right here, if you can kind of see, there are little black pins, and all of those are auto shop related. And in this particular area is where we saw that deep red. Here's just a picture of the Lower Tower Hill neighborhood. And in this image right here, we used a FLIR camera, which is a thermal camera that can take pictures, and it really highlights the amount of heat. This picture was taken in the summer of 2023. It was pretty hot out, but you can see how where there is tree shade, it is 88.4 degrees. Compared to the area where the pavement is, it can reach up to 128 degrees. So welcome to the Lawrence Palante team. It is made up of 5 amazing members. We have Irvania Ortega, Evelyn or Eve Rodriguez, Destiny Gonzalez, Dorian Straker, and Adolis Ramos. If you guys are in the chat, if you can, a thumbs up, give us, would be great. So now you might be thinking, how could I get involved? What does that entail? You can join the Lawrence Palante team to help us create and put into action community-based responses to build climate resilience. We are fortunate enough to be able to give members a stipend for participation. And if you do have any questions, you can follow up with me via email. There are some upcoming events happening at Groundwork Lawrence, and we would love for you to join us in 2024. We have Arbor Day in April, Earth Day in May, the Kite Festival or Salsa Festival in June. Then we have the Groundwork Lawrence Greenway 5K in August, the Spigot River cleanup in September, and we are celebrating the 25 years of Groundwork Lawrence. So join us at our Glow Gala in November. And we do have the farmers market. We have a winter farmers market and then a summer's farmers market. If you're around in town, we are hosting the farmers market this upcoming Saturday on the 10th from 10 a.m. to 4 p.m. Other ways to get involved is completing the Climate Safe Neighborhood Survey. It just helps us get a better understanding of how the community feels and help us define those goals for climate safe neighborhoods. The QR code here shows the survey in English, and then it's also available in Spanish. Thank you. And then from now, we'll pass it on to Julie.
All right, I'm going to go ahead and try to share my screen so we can put up our slides, if that's okay. I think you're still sharing your screen, so I can't do that yet. Perfect. Thank you.
Thank you.
Give me 1 second. All right. Can everybody see the slides? Or a Slido screen? Perfect. I'm going to try to exit from. All right. So we're going to try to do a little bit of a, oh, sorry, it went to the very end. I'm sorry, everybody. We're going to try to do a little bit of interactivity. So I'm just going to try to get everything set up. It works best if everybody has like a cell phone, or you can use the Slido on, I'll show you the slide to where you can scan the QR code or type it into whatever website, like whatever internet browsing thing you use to get involved. So this is our presentation on effects of climate change on public health in the city of Lawrence. And it's presented by various Greater Lawrence Family Health Center residents, as you all met us earlier. So this is just a few pictures, a little bit more about us. So in the top picture, it's some of our co-residents in the hospital, but we primarily are based out of the 34 Haverhill Street Clinic of the Greater Lawrence Family Health Center. As residents, we are physicians in training who are here for about 4 years, and a lot of our residents will actually stay on and become physicians full-time at Greater Lawrence Family Health Center around the area. And we also have a group here that is very passionate about climate change and the effect of medicine on climate change as well. So with this slide, if you all can just type in either slido.com to your internet browser, wherever you choose to browse the internet, or take a picture of the QR code and go ahead and type in those numbers to get involved in our QR, to get involved in the interactive portion of our presentation. If it doesn't work, that's okay. We're trying it out. All right. So I'm going to go ahead and go to the next slide. It'll be on each slide. So the first question is, what are you most excited to learn about today? And I believe you can rank these, or you can choose one. Give you all a few moments for that. Awesome. So it looks like a lot of people are interested in specifically how Lawrence is vulnerable to climate change and our patient population here as well, and also how climate change affects health. So we're going to be covering these topics in our presentation. All right. I'm going to pass it off to my colleague, Amanda.
All right, so I'm gonna start with a little bit of intro about the climate crisis in general. So this is the biggest public health crisis challenge we have. To be honest, I didn't really understand that climate change was a big deal until I connected it to like the effects on health. I wish I could say I was on board with this a long time ago. Once I really started to understand the effects on health, I was like, wow, this really matters. It affects the weather, our environment, and this can cause effects on everything, on our water, our food, our air, our sleep. According to the WHO, between 2030 and 2050, climate change alone is expected to cause 250,000 additional deaths per year from things like malnutrition, malaria, diarrhea, and heat stress alone, which is really scary and just kind of overwhelming. This graphic just kind of shows some of the effects from rises in temperature and precipitation, from rises in greenhouse gases, which can have direct effects and indirect effects. For example, with air pollution, this can directly, obviously, impact our breathing, our heart diseases, but then indirectly, it can affect things like smog and visibility, our ability to be productive at work and school, and then crops and the food we eat, which all can have other effects on health. Heat can affect things like directly, we can get heat stroke. We can have a hard time with pre-existing health conditions like asthma, for example. And there's mortality risks because of this. And then indirectly, this causes a strain on the workforce, on infrastructure. It all kind of has downstream effects. As far as water, some of the direct effects can be diseases, like thinking back to the cholera epidemic back a couple centuries ago, things like drowning, mental stress, and then indirectly, this can also lead to respiratory ailments, strain on workforce, and then wildfires, conversely, with the drought side of things. And then as far as ecosystems, we can have direct effects on diseases that are spread through bugs, critters, like West Nile virus, Lyme disease, and then indirect effects on our jobs again, and financial strains. You can go to the next slide. And this is just another graphic kind of showing some of the big risks of climate change, like extreme weather events, heat, sea level rise, air pollution. And then I really want to stress how this affects way disproportionately the most vulnerable and disadvantaged folks in our community. This includes women, children, ethnic minorities, poor communities, migrants, which we have so many of in Lawrence, people who are displaced from their homes, older adults, and anybody with underlying health conditions. We know that every vulnerable group is just affected by these things more, and can affect all of those health outcomes you see at the bottom. Yeah, you can go to the next slide. And then this is again addressing some of the indirect effects of climate change on health. For example, unpredictable weather we've seen in our own clinic can lead to clinic and hospital closures when we've had huge rainstorms. We've had to shut down clinics for the day or go full telehealth, which really can reduce the access to care for our patients. It can affect buses, trains, especially for people who need to work. And then when we have clinic closures, we also get pharmacy closures and people lose access to their essential medications. And then in general, you can have instability in other parts of your life, like finances, employment, relationships, and all of this has downstream effects to your health. You can go to the next slide.
Hi, everyone. Can you hear me? Great. So thanks for having us. I'm Jack Gordon. I'm one of the fourth year residents. And so I wanted to dive into some more particular aspects of climate change and how it can affect Lawrence. So our first subtopic is heat illness. We just saw on the map earlier that many parts of Lawrence are going to be like hotter than others. And it looks like we have a Slido quiz coming up. Let's see what the quiz is. So let's take a few seconds to answer this and then we'll discuss. Oh, mine says voting closed.
I think I fixed
Julie, are
it,
we
but it's also, we kind of answered it a little bit earlier, so we'll move
are
on.
we able to reopen the poll?
I thought I did. Oh, there we go. Is it open now or no?
It looks like some folks are putting answers in the Q&A, that's a totally good backup option. We've got one vote for true. Another vote for true.
Great.
Okay, I'm seeing a lot of votes for true, and yes, we are high risk for heat illness, partially because our summers are so hot and wet, and humidity also affects the way that we experience heat. Partially because we have very little tree cover compared to other parts of the state of Massachusetts, other parts of the country, and also we just have like proof from these maps that we are getting really hot temperatures here in Lawrence. And every summer in the last few years has been hotter than any other summer on record. Like every year it gets hotter. So these numbers are only going up. And if for those of you who live in Lawrence, you can look at that map and kind of try to picture where you live. I personally live in South Lawrence and I live on Broadway or like right off of Broadway. So I'm in the middle of that dark red patch in South Lawrence, unfortunately. Okay, next slide. So let's talk about heat illness. And you may have heard these terms before in the past, the difference like heat exhaustion, heat stroke. We kind of generally lump these together into the overall topic of heat illness, but they're different syndromes or different ways that people can be affected by heat. So heat exhaustion is what you get before you go into full-on heat stroke. And these are both very dangerous. Heat stroke can lead to death. Every year in the news, you'll see some news articles about athletes that are, working out in very high temperatures who can die from heat stroke. So the warning signs that you could be experiencing heat exhaustion are in danger for heat stroke are these signs like headache or feeling dizzy, having nausea, vomiting, muscle cramps, fatigue, and then kind of paradoxically, feeling cool and looking pale. And that's something where you might be expecting that people will be, hot, but the having the hot skin is more of a late response when your body's homeostatic mechanisms are breaking down and no longer able to keep you cool. And then below this, under the person running, you can see some recommendations this is from the Minnesota Department of Health, but these are true here too. What to do is you should identify if you or a person you're with has signs of heat exhaustion, and then immediately move to a cooler place, drink cold water, lie down. You can use cloths. You can get your clothing wet or use a towel to get some cloth on you that's got some cold water on it, that kind of thing. Okay, next slide. And many young people are going to experience heat different from older folks, especially people with kidney disease, asthma, heart disease. The heat can be much more dangerous. Um, Kidneys, they tell our body how to regulate water balance and electrolyte balance in our bodies. And when you're sweating a bunch in the heat, that can throw these levels off. You might get easily dehydrated and you might lose a lot of electrolytes in your sweat. And so that can cause kidney problems. And folks who already have kidney problems, but for example, they have kidney failure and on dialysis, are critically vulnerable to heat stroke. Similarly, people with heart disease might have exacerbations of heart failure or be more vulnerable to a heart attack. And this may not be obvious, but somehow hot days are associated with much worse air quality. And I don't remember exactly why, but maybe that's something to do with us all running our air conditioners, trying to keep cool. Pregnant people are also high risk because the babies don't easily regulate their temperature. And also so the baby's at risk, and also the mom is at risk because there's the mom is trying to keep the baby cool, and so further stressing her own homeostatic mechanisms, and is trying to keep the baby hydrated, and so that may make the mom more easily dehydrated. And then lastly, I just put a brief list of medications that can be cause problems if you're dehydrated or you're at risk for heat stroke or you have those electrolyte problems. However, there's like 100 medications that are on the official CDC guidelines. So if you are taking medications, any medication at all, just talk to your doctor about what you can do to stay safe during a heat wave. Okay, next slide. Okay, we talked about this briefly. I love this illustration. This is from NPR, but this perfectly illustrates what you can do if you or a loved one is experiencing heat illness. And the main thing is to just get cool. And then I'm going to move on quickly from this slide to talk about cooling centers. I think that's the next slide. Great. So many people in Lawrence are not going to have air conditioning, in spite of the fact that we live in a city that gets really hot during the summer. And that's a situation that could be, dangerous if it's very hot and, having a fan or, running some cold water or other things is not keeping cool enough. So for those people, we recommend going to any of these cooling centers. I think, for example, the Lawrence Public Library is a big air-conditioned building. The Thuin Senior Center, I was there today. They've got air conditioning. I haven't been to the other two, but they're here for a reason. They're cooling centers, and this isn't just for me. I have air conditioning in my house, but this is something where if I see somebody around, maybe one of my neighbors or somebody I know that's vulnerable, I can advise them to go to these cooling centers or make a plan for them to get there during a heat wave if they don't have transportation or they don't otherwise know that this is a resource. Next slide.
All right, I am going to do a little bit of a deeper dive into floods in Lawrence specifically. So here's another map of Lawrence. This shows the areas of flooding that we would expect if there is really heavy rainfall in Lawrence. And I think a lot of us tend to think of flooding as a future problem, but it's actually a now problem as well. As you can see, the areas are all around the Merrimack River are highly impacted, but around the Spigot River has a huge flood zone as well. And this includes areas like Lawrence General Hospital and the Greater Lawrence Clinic at 34 Haverhill Street, where we all work. That's kind of where that red dot in the center is. And we've experienced these flooding issues when there's been big rainstorms already. And so when there's big storms, you could consider going to other sites like Holy Family Hospital if you need to seek emergency medical care. Or our other clinic sites, for example, in Methuen, Park Street, Essex Street. And if that's something you can do, and you can also consider moving your medications to somewhere else if it's an emergency. One thing we could recommend to consider is just having a supply of clean drinking water for everyone in the house in case there's a big flood issue and water shuts down. and as well as additional medications for folks that need those important meds every day. You can go to the next slide. This is just a great graphic that shows a lot of good tips for if there's a flood that affects you. Number one would be just evacuate if directed to, evacuate if local authorities are saying now's the time. Never try to wait it out, or especially drive through flooded waters. And use those emergency phone numbers if you're stuck. And importantly, to remember that floodwaters often also have things like sewage and toxins, chemicals, bacteria, soiled water, especially in city areas where there's more industrial things going on. And you can also have oil, diesel, garbage, animals that get stuck in the flooding. So never ever drink that water or spend time in it. And standing water, which is water that is not moving, just leads to a breeding ground for bacteria, viruses, mold. And then down the line, those can kind of evaporate or go into the air and cause us lung disease, even when flooding is coming from something like rainwater and not from something that we think of as more dirty. Folks can get bacterial illnesses, viral illnesses, mold in the lungs, and then even allergic reactions in folks that are sick. We also have to think about electricity and power as an environmental risk. Turning off gas, power, and water when lines are down, and never going near those power lines that are down. If you're out of electricity, people might consider using portable gasoline or diesel powered generators, gas stoves, charcoal stoves, grills, all that kind of stuff. But using them inside can cause a buildup of carbon monoxide, which is also really dangerous and reduces our ability to bring oxygenated blood to our cells. All really scary stuff. And we should, just another reminder, we should never be using ovens or gas to heat our homes, or be burning any of that stuff inside the homes. You can go to the next slide. I think we talked about most of the stuff. Oh, back one. Thank you. And this is for after the flood is over. The first thing we want to do is try stopping more water from coming in, and then thinking back and protecting our vulnerable populations like we talked about in the beginning. This includes children, elderly who might be stuck in their houses, who don't have the mobility to get out, folks with disabilities, or anybody with a chronic disease or a suppressed immune system, are all at high risk. And then we want to pay attention to where water is, but also where water was, to see where there might be damage that can grow bacteria and mold even after the water is gone. And then once we're in the cleanup phase, wearing protective gear is really important, so we're not breathing in gross stuff. And cleaning up as soon as it's safe to return helps prevent the spread of those bugs. We also want to make sure the home is safe before getting started. Again, thinking about the electricity sources, the gas sources. If there's any concern about water, just turning off the electricity and gas at the source. And then afterwards, there's a risk of inhaling dust, building materials, contaminants, microorganisms. So going back to those N95s that we are all very familiar with, to protect ourselves, Unfortunately, they do not protect against gases, things like carbon monoxide. And in children and folks with a lot of facial hair, they also don't protect us. Like Jack. And when in doubt, just toss it out. If, for example, if rugs have been soaked by water, clothing, couches, furnishing, walls, if we can't thoroughly clean and dry something, we should really throw it out, even though that is against the mindset of climate change and reusing and recycling. We need to keep ourselves safe. Drying out, unfortunately, doesn't get rid of mold and bacteria. Yeah, disposing things up correctly is important. And then also making sure that we are not getting other critters like dust mites, cockroaches, mice, which all love moldy things, and can be really bad for folks with asthma and other lung diseases or allergic diseases. And then don't forget about the physical and mental stress about dealing with floods, especially, again, those with chronic conditions and the elderly. And then another effect that we might not have thought about is if a lot of folks are displaced and then have to live together in a close area for a while, thinking about like after hurricanes, when folks are all kind of staying in that school gym is the picture I have. You can get a lot of spread of airborne diseases, COVID in the winter, flu, tuberculosis, pneumonia, which puts such a strain on our hospitals. And then if we do have floods and then we do have to rebuild and repair, we want to think about a design that, if there's another flood, won't lead to the same kind of damage, and rebuilding things a different way. I think that's all the stuff we were going to talk about on that side.
Okay. Hi, I'll talk about air pollution for a few minutes. So we can go to the next slide. Oh, great, another poll.
Can you just free text anything that you think may contribute to air pollution? My phone says there's about 5 people still typing, so
Oh, wow, we've got
there we
quite a
go.
few responses. Metal waste facilities. Those are like famous for putting a lot of nasty chemicals in the air, and metals, heavy metals as well. Car exhaust, cars and buses, cars. Yeah, pollen, that was my response, and I'll explain that one in a few seconds. Airplanes. Yeah, these are all factors. Like anything that burns something and puts particles in the atmosphere is a factor for air pollution. I think the quantity of billionaires that are being burnt and put in the atmosphere is pretty low, but they disproportionately contribute to air pollution in other ways. Okay, next slide. This graphic kind of summarizes everything. And the one thing it leaves out is the pollen. And I should also say that I'm really passionate about air pollution because I have asthma. And I think about this like all the time. Like hot days, I'm thinking about air pollution, and days where there's a lot of pollen in the air. And I see a bunch of kids coming in with asthma exacerbations or allergy exacerbations. It's just something that's always on my mind. And just to explain the pollen link to climate change, there's a lot of species that are invasive, like ragweed, other common grasses and weeds that grow and are spread by development, essentially, and the destruction of natural environments. And these species are very opportunistic for dispersing their pollen in the atmosphere, and they're windborne seeds, I guess. And those are very irritating to our lungs. Mold is also very irritating to lungs. And then everything else on this slide is also super irritating to lungs. I don't want to downplay all this other stuff and say that mold is just like, is worse or just as bad. Like everything else is super bad as well. But I just wanted to bring up this like little known fact that is one of the reasons why we see so many people with asthma exacerbations and allergy exacerbations during and after heat waves. Okay, next slide. So how can air pollution affect our health? This is a really complicated slide, but I'm going to try and simplify it as much as possible by saying the lungs are right next to the heart, and blood gets pumped from the heart into the lungs, and then it goes back into the heart again and sent to the rest of the body. So any problem in the lungs is going to get distributed to the rest of the body. Any inflammation, any negative like lung cancer, that's how it spreads to the rest of the body. Like any problem in the lungs is going to go everywhere in your body and cause a lot of downstream effects. Heart disease is a big one because heart disease is the #1 cause of death in America for most adults. And that's caused by like blockages in the arteries that supply the heart with blood. Those blockages are caused by long-term inflammation, essentially, that leads to the buildup of cholesterol and other nasty stuff. So there's been studies that show that during periods of really bad air quality, heart attack rates go way up. Okay, next slide. Okay, so again, we're always bringing this back to like who is at greatest risk and how does this affect Lawrence? So you can keep track of the air quality in Lawrence. There's a little link I put in the bottom right, and you can basically just Google air quality in Lawrence, and there's a few websites that'll give you an immediate response. Lawrence has a lot of heavy industry and a lot of like a lack of tree cover. And both these things negatively impact our air quality. And on the left-hand side, we have a list of people who are especially vulnerable, and Lawrence checks all these boxes. We have a lot of folks who have chronic diseases, are experiencing poverty or racial discrimination that affects their ability to get treatment for their chronic diseases or appropriately diagnosed. We are lucky to live in an environment with multiple generations, or sorry, a city with multiple generations. Unfortunately, children and elderly are especially vulnerable to air quality. Yeah, people with chronic diseases like COPD, asthma, lung cancer, heart attack, strokes, these are all people who are going to be disproportionately affected. Lastly, Lawrence has unfortunately a pretty low quality built environment. A lot of our current housing is a pretty old stock. And so there is disproportionately, in my opinion, I don't have statistics to prove this, but in my opinion, there's disproportionately more buildings that are affected by mold, who don't have appropriate filters, who have, who might be using heat sources to heat the house that's low air quality. Okay, next slide. What can we do? There's a lot that we can do. Fortunately, there's a lot. So the first thing is just pay attention to the weather and the air quality index, and be on alert when that goes from green to yellow. Even yellow is going to start causing problems for a lot of people. And if you know somebody in your life or in your neighborhood that is very vulnerable to this and who might not be spending a lot of time online being aware of this, then it might be a good idea to alert them and talk about a plan. So here's some things that they or you can do. First is on days with low air quality, avoid spending time outside. And if you do have to go outside, wear a mask. An N95 mask is the best because that will filter the particulates that are larger than a certain size. When you're inside, if you can, keep the windows closed. Okay, run the air conditioning if you have one on a setting that includes a filter or a recirculate setting that doesn't bring in air from the outside. And then there's this really cool trick that I've seen and that is recommended by the American Lung Association, where people will take a fan and then tape a HEPA filter to the fan. You can buy these HEPA filters for less than $20, I think, for a 2-pack, or about $20 for a 2-pack at Home Depot, and you can buy the box fan for a similar price. So altogether, your total expenses are about $50, and you can get HEPA air filter for your room. It's not going to be super high powered. It's not going to last long. but that's something you can set up in a room that you can set up for somebody who's like really vulnerable to low air quality. And don't forget to spend time outdoors on days with high air quality to build your cardiovascular fitness. Okay, next slide. Oh yeah, this is more details about how to build that safe room for your house if you're extremely vulnerable or if you know somebody who is. And it includes a lot of common sense, like in your safe room or your clean room. That should be a place where you're not burning candles or doing other things in that room that are reducing the air quality. Even if you're not smoking currently or burning candles currently, that soot will build up on the walls and reduce the long-term air quality. And all this information is available if you just Google like lung.org, clean room, and you can get this information a lot more on the internet. Let's move on to the next slide. Oh, okay, I'm going to pass off to Julie.
All right. So I'm going to talk about mental health, and we think it's important to talk about because about 48% of Americans feel like their mental health is affected by climate change as well. And this can be in various different ways. You can have the direct effects related to like stress after like extreme weather events, or also like the slower moving, more insidious effects from like losing your job due to climate change or lack of access to healthcare as well. This highlights 3 aspects in particular, and one is very special to my heart because one of my favorite ways to decrease my stress is to get outside. And so protecting our climates by like advocating for policies that can help protect our climates can actually allow us to spend more time in nature, and will lower our stress levels or reduce stress-related illnesses. Also, extreme heat has been connected with an increase in hospital admissions for people with mental health issues. It has also been associated with an increase in suicide, as well as an increase in people using alcohol to cope with the stress related to climate change or extreme heat. And then lastly, people who suffer from mental health disorders are more vulnerable just in general to these extreme weather events. They're one of the vulnerable groups. And also some like examples of this, like medications can inhibit our body's response to heat, or also it can also like not like people on these medications will not see the signals that our bodies are trying to show us if it's becoming too hot, or our body's not allowed to adapt to these changes in our environment because we are inhibiting those responses with the medications that can help with their mental health disorders. So as physicians, we always like to talk about what are ways that you can kind of see if this problem is becoming a problem in your life. So some aspect, like some signs of this would be if you're having more like increasing problems at home, finding that you're more irritable, you're using more alcohol to cope, or you notice these differences and it's not getting better after a few days, or the things that used to work before are no longer working for you. You don't feel right, or somebody who's very close to you who knows you really well is saying that there's something off in your life. These are all signs to go and talk with your doctor or your therapist about this. And on the right hand of the screen, you can kind of see that like the amount of interest that the interest of people to talk to therapists or doctors about like global warming or the changes in our world that has effects on them, and it just kind of stratifies it by different groups. And so I think as physicians, or even just people in the medical field, people want to talk about these things, and we should really pay attention to that. And also in Lawrence, we, as a physician here, I do treat a lot of people with different mental health illnesses. And if people are feeling that they're having they're finding themselves suffering from the effects of mental health, especially related to climate change, there is a lot of access to resources in the area. You can come to Greater Lawrence, but we will also just refer you back to other great places in the community like Leahy Behavioral Health or other places. And you can always come to Greater Lawrence. We have this sheet out that we can hand out to people. And so we always encourage it, and it will be in these slides. So if people need access to resources there. It's a quite lengthy sheet. And then lastly, we just wanted to talk about some effective actions against climate change. One of the best ways is to eat more plant-rich diet or go vegetarian or vegan, or just choose a few days a week where you eat more vegetarian or vegan. Driving less, really using the public transport system, and the public transport system in Lawrence is great too. And I would believe it's free most of the time, so using that would be great. Taking one less flight per year, just making a decision to do a vacation at home or to visit areas around you rather than across the world. Buying less stuff, reusing the stuff you have, going to thrift stores, buying some things from there, changing out your old appliances to more energy efficient appliances, switching your light bulbs to LED light bulbs, and then planting trees. I think as residents here at Greater Lawrence, we got to work with Groundwork Lawrence and got to plant some trees about a year ago, and it was really fun. It's a great way to get involved into your community and seeing where we need to plant more trees in our community as well. But most of all, just getting involved, educating yourself is one of the best ways. And we can create great partnerships in our community via all the different organizations that we're representing here today. Here's some of the organizations in the community and what they're doing in the area as well. All right, so our last poll is, what is one action you will take moving forward to, I can't read the last part of the slide, to help fight against climate change? And then after this, we will have a question and answer. So if people wanted to type their questions in the chat or unmute yourself and ask questions, we can kind of go from there. So these are some of the responses. Vegan days, eating more vegan food, talking about it with your patients, one less flight. Well, we appreciate you all paying attention to our presentation, and it was an honor to be able to give that presentation to you all. But we are also here to kind of answer any questions that you may have. And I think these questions can be for anybody in the group, not just us. But that is why we're here. And I know that I think we did get some questions prior to the presentation as well that I can also pull up, or Alejandra, if you have those, we can also answer those questions.
Yeah, let me just take a look. Hold on. So one of the questions that came in from an individual who signed up and registered for the event was, what is the biggest public health concern?
In my opinion, all the issues that we talked about today seem incredibly big and challenging, and I don't know where to start. But I think that the one thing we've already started to see a lot of in the last 10 to 20 years are people with respiratory diseases. That like there's more people with respiratory diseases than we used to see, like more children with asthma and more adults with heart disease and lung disease. And the mental health crisis that kind of really was brought to public attention with COVID, also it seems to be profoundly linked to climate change, and that's something that's really terrible.
Thank you for that. Another question that came in was, how do you hope to get the community both aware and involved in making considerable change in our area?
I think one of my visions for this is just creating more of these partnerships where we're able to discuss these issues more and really lean on each other where we're already working, so that we can educate the people around us, educate ourselves, and you know, bring that to our patients, bring that to our community, and also create opportunities that are our community can participate in easily and kind of learn more about the changes in the world around us and how they can affect that.
I agree with Julie. I think sometimes we get so, you know, in our silos of what we're all doing individually as doctors, residents, community organizations, and I think we just do so much more when we get into the community and partner with each other. So I'm so excited about this.
And I just want to say that, everyone has a voice, and we can all try next year to use whatever voice we have to reach out to people. I know as a doctor, I can reach out to patients and talk to them about the health risks of climate change and encourage them to, think about those risks and come up with a plan for how they're going to stay safe and keep their families and their neighborhoods safe during this summer's heat waves and possible floods. And I think, even if you're not a doctor, you're just a community member, I'm sure you have people around you that you can talk to and kind of share these concerns with and come up with a group plan together.
Thank you. And I would say for us at Groundwork Lawrence, we do hope to get the community aware and involved in making change by continuing to host events like these. So thank you, Julie and all of the guest speakers who spoke tonight. We'll be sharing the recording on social media. So for those who weren't able to join, can still get all of that wonderful information that you provided. So thank you so much. We also hope to schedule community projects such as tree planting again and community science. So I'll just share some final thoughts. I'm going to go ahead and share my screen again. So as we close for the evening, I just want to say, stay connected so you can continue to learn more about our efforts. Follow us on social media through the Lawrence Palante Instagram page or on Facebook. Another great way to get involved in the neighborhood of Lower Tower Hill, as it's part of our Climate Safe Neighborhoods project, I would say join a Tower Hill Neighborhood Association meeting. It is a great way to learn about your community, to be able to provide feedback and comments or make suggestions. The police department's there, city council is there, so I would definitely recommend it. Or join a neighborhood association meeting in your area. By getting the residents involved and out in the community, we will share our concerns and we hope to make progress in resolving those issues. If you were interested, the Tower Hill Neighborhood Association meeting is February 28th. And if you can, or if you haven't completed it yet, I would say and encourage you all to complete the Climate Safe Neighborhood Survey. QR code is here, available in English and both Spanish. And after the recording ends, I'll go ahead and send over that information. Another great way, I'll mention it again, Lawrence Palante joined the team in 2024. So a lot of what was mentioned in terms of climate change and public health, we're trying to address through the Climate Safe Neighborhoods project. The goal is to really get the community involved and lead that community-based change. We want to build a climate resilient Lawrence. As you guys mentioned, the temperature continues to rise. It is an issue that we have to address. So addressing extreme heat could look like more tree planting or pushing for more shade structures. And then with flooding, that could be like pushing more rain gardens in the community, decreasing the amount of impervious surfaces and therefore increasing green spaces. So that's what the Lawrence Palante team is involved in doing. So we hope that you'll be part of all of the projects that we have planned for 2024. And as a reminder, members who do join the Lawrence Palante team receive a stipend for participation. And lastly, if you can, just scan the QR code here for a presentation feedback survey, but I'll go ahead and insert that in the chat as well. Any questions, comments, or feedback, or anything like that?
Actually, yeah, there was one question in the Slido poll, which I think is a excellent question. It wasn't mine, but it's anonymous. Question is, many people still believe climate change is a hoax. What steps would the team take to change this narrative? I think that's an important topic to discuss.
Yeah, that's great. I'll start. I'll say the biggest thing would be data. We can talk and talk and talk, but if individuals don't see the visuals and the data that is available, such as the maps, the dashboard, the thermal cameras, air quality monitors, that is our tool to be able to convince or at least educate and bring awareness to the public, and then therefore get their support to lead that change that we want to see and build that climate resilient Lawrence.
I would also say that you don't have to believe that climate change is a man-made phenomenon to believe that heat waves and reduced air quality and floods are a danger to yourself and to the public health. And anyone who wants to take action to help keep everyone safe from these events or to reduce their frequency is on the right path, regardless of their personal beliefs.
And I would also add, conversely to the data point, data is amazing and I love data, but for some people you also just like need to make it personal and appeal, I guess, like to the emotional side of things. Like don't you think, like, wow, yeah, we did get more snow days when we were kids, or one thing or another. Like, it's almost like the world is getting hotter. I think for some people, just relating it back to one personal thing can make a difference too, whether they believe it or not.
Yeah, that's huge. I think that's an important point, Amanda. Thank you for bringing that up. Any other questions, comments, or feedback? All right. Well, thank you so much for joining us this evening. Like I said, I'll go ahead and share the slides, any Zoom links that were shared during the slides, and I'll share the slides as well. So reach out if you have any questions or feedback afterwards. Thank you so much and have a good night.